Hey everybody, Saul Marquez here with the Outcomes Rocket, and I'm excited to launch another podcast as part of the entire series around compliance in the healthcare space with MedTrainer. And so with that, I want to introduce Dr. Hira Rashid. She uses her expertise in public policy to ensure MedTrainer course content meets the requirements for regulatory compliance and professional licensure. Dr. Rashid earned both a master's degree and a doctorate degree in public policy before joining MedTrainer in 2021. As the senior program manager, she collaborates with the team of SMEs to review legislative and regulatory changes in healthcare compliance requirements at the federal and state level, and leverages this information to create risk management plans for MedTrainer clients and create strategic plans for course development. I'm excited to have her on the podcast here. Hira, welcome.
Thanks, Saul. Great to be here. Thanks for
It's
having me.
it's such a pleasure to have you on the podcast to go over this very important topic. And regulations are always changing, and it's so hard to stay on top of these things. So it's great that you and teams like yours are doing this for us. Before we dive into the content of today's episode, Hira, I'd love to really help the listeners get to know you a little bit better. What is it that inspires your work in the healthcare space?
Well, thank you first of all for that great introduction. I think beyond all of that professional information, I think what really got me interested in healthcare compliance was a personal experience. I think I was around maybe 19, 20, and we found out that my mother was diagnosed with cancer. And, as the primary caregiver at the time, I was trying to navigate a lot of the healthcare landscape for her. And I think what really got me frustrated was that you could find the clinicians and you could find the care and you could find what you were looking for. But really, what you struggled with was to be in front of the right provider at the right time with the correct mindset of looking for the things that were wrong with like this one particular person's body and what was going on specifically with them. And I think that frustration really for me was at a system level, right? So we met some of the best providers and some of the best caregivers and all of that stuff, but really what frustrated me was that you didn't have processes to get you to the right kind of care at the right time and to be diagnosed properly. So in her case, it progressed undiagnosed until she needed extensive chemo and radiation and surgery and all of that. And
Mm.
thankfully she's fine now. But
Oh,
once
thank
she
God.
got that care, she was able to recover and all of that. But the point is that she didn't have to get to that point. And that really is what inspired me. So that led me to my policy work. I started, of course, in academia with like a bunch of this research. Some of it was, of course, catered towards maternal health, reproductive health, obstetrics and all of that stuff. And then beyond that, just like health services research, healthcare delivery models, program evaluations for healthcare interventions and policy work.
Thank you for sharing that story. I'm glad your mom is okay.
Things.
And it served as a catalyst for I think really important work that you're focused on. And so, can you provide our listeners with an overview of this complex landscape of healthcare policy, and maybe just highlight some of the key challenges and nuances that healthcare organizations face today?
Absolutely. Yeah. So this is where the researcher in me kind of kicks in, right? Like landscape and broad overview. So I think one of the things that we tend to think is happening in the policy world, especially as like providers who are doing their day-to-day, compliance stuff is, there's this idea that policy is coming from this like central location of just completely thought out and well formulated ideas and plans and outcomes. And oftentimes it's not. So policy is something that's shifting. It's happening as a result of negotiations, as a solution to some problems that people might not be aware of or might not even be applicable to them. And then they're just impacted by that broad-based solution, like you have to do X training for X hours by X date, right? And that might not even be applicable to certain providers or certain organizations because they're not facing the same problems. So I think that's the big thing to understand is that, oftentimes you're going to be frustrated with policy because it doesn't apply to you, but it applies to somebody somewhere to, people who are supposed to implement actions to address that policy solution. So I think that's one thing. The other thing I would like to say around healthcare landscape is I think there's a focus on, I want to say, processes rather than systems. So a lot of the compliance challenges that folks continue to face when I work with them is that they've built processes for compliance. So that's, sort of like creating a training binder, making sure that providers are credentialed by hiring a credentialing specialist, and only that person knows what the credentialing process is, right? Or like license verification processes, and not having a system in place that can kind of, you know, uh, be okay and still be stable and continue to work after people transition out or people are, move to other roles or additional regulations come in. So I think that's really at the landscape level, really, you have to think about compliance systems and not just having processes.
Many of us can think about a time when we have, we feel organized and we feel like our organization has everything where it needs to be. And then that one key individual leaves and it
Right.
falls apart. And gosh, this is such a pain point for, I think, a lot of healthcare organizations specific to this complex area of compliance. In your experience, and you guys work with a lot of different clients across the landscape, what are some of the common pain points that healthcare organizations run into when trying to navigate and comply with healthcare policies?
Healthcare is deeply fragmented, even in the way that it's provided, right? So the pain points in my experience for large organizations that have consolidated a bunch of practices and, have a bunch of locations and have like a, 1,000-person staff, the problems that impact them are going to be more focused around things like we have six different federal organizations that create regulation that, impact this large healthcare organization, for instance. So that's like CMS, they're impacted by what the OIG is doing, they're impacted by OSHA, by HIPAA, like all of that stuff, right?
Mm.
But then on another level, you have your small, like single provider practices or two or three provider practices, and the challenges for them look very different. So in a larger organization, you're going to struggle with having too many resources. You're going to struggle with making sure that not everybody's taking every training and ending up with like 20 hours of work to do.
Mm.
At the single provider or two or three provider level, they don't have a compliance officer. They don't have anybody who's looking to see what regulatory changes are coming in. They're getting memos from like the state Department of Health, or they're getting memos from like CMS, and they're like, oh no, I have to comply with this training. And then they have to figure out how that training applies to them, the services that they provide, what is the timeline and schedule for that look like? So I think that's really, and then if you're like in a rural area, right, like where there's maybe like a healthcare desert sort of situation, you're not really able to understand how those training needs can be met with the limited resources that you have and the limited technology that you have. So I think that those are the key areas, having too much training for large organizations and then not really knowing what to do to be compliant for smaller organizations that don't have the staff.
You have this down. You've seen it, and so when it comes to compliance, folks, there's breaking points. And I think Hira is highlighting some of those breaking points that your respective organizations might have. How does MedTrainer come in and help at these different levels?
Think we do a few different things. Of course, we're like a software solution for broad compliance, not just training compliance, which is my focus, but broad overall compliance for credentialing, license verifications, exclusion checks, all of that stuff. So I think for larger organizations, they have the ability to implement the software. So we come in as sort of a technology solution that they're kind of ready for, right? So with any sort of intervention, timing matters. Timing is really important. And I think that's something that we actually help when we sell our software to our customers. That's something that we help them figure out is readiness, right? So readiness for implementation. And if they're not ready to implement the software, we help them understand what they need to become ready to implement the software. So that's one thing that we do for larger organizations. For smaller organizations, we actually kind of help them understand what their compliance needs are as well. So we try not to be prescriptive because that's always a risk, right? We're not in their location. We're not understanding where they're located, what their patient population is, what the specific organizational risks are that they're struggling with. but we try to get as much information from them as possible. So we have these like really candid discussions with them. So it might be like me and uh, a vice president of compliance, our lead nurse leader, like a team of people who can help them understand what their need is, and then kind of let them go back to the drawing board and come back to us and say, you know what, okay, I understand what my needs are now. These are the areas that I need help in. So that might include a training plan, or whether or not they need to do a security risk assessment for HIPAA, or whether or not they need to have an emergency management plan that's more curated to the risks they're facing. So that's really the insight we're able to provide for smaller providers as like a software solution.
You guys have helped a lot of people, a lot of organizations at either side of the spectrum. So the opportunity is big, folks. I love doing this. I love having conversations with leaders like Hira, because I'm able to position some people that do great things like MedTrainer, Hira, and the team over there with the needs in the market. And I've been hearing a lot of pain points from people in the market on this topic. So I'm excited for you to be in the know of the work that MedTrainer does. And obviously in the show notes of this podcast and the entire series, we're going to leave ways to get in touch with them. And so make sure you do. Don't stop at just listening at this podcast. If you have a pain point there, take action. Look, and sort of you said this at the beginning here. Policies shift, they change, and oftentimes create uncertainty. How can healthcare organizations stay adaptable and responsive to these changes while maintaining high quality patient care?
Well, like you said, you want to talk to somebody who has their finger on the pulse, right? So MedTrainer does that a lot. We do our webinars that are open to the public, so people can attend and register as
Saw that.
yeah, for whatever's applicable to them. So I think that's important. So really, being in the know is important. So, webinars, just podcasts like these are important to listen to be in the know. But I think beyond this, what is important to understand is that there are trends in policy, right? So you're not going to go backwards. We're sort of progressing towards certain outcomes that we're interested in as a country, right? So one of those trends is the federal government is leading the charge for reducing the cost of healthcare, right? They're leading the charge for improving healthcare outcomes. They're leading the charge for providing quality care, patient-centered care, making sure that care is culturally competent. So those are, the quadruple aim, initiatives that come out at the federal level are important to follow, because the private sector is going to follow that lead. So if you see that CMS is creating a lot of cultural competency content, implicit bias content, states are going to start creating that. Their states are going to start following their lead and mandating regulatory requirements that follow that cultural competency model of care. So I think that's important to look at what the federal government is doing, specifically what Medicaid, Medicare providers are being required to do. And it's going to become something a year, 2 years, 3 years down the line, it's going to become something that folks have to do. I think a great example here is a law that was passed in 2015. So MACRA was passed in 2015. It established MINTS, which
Mm.
is kind of a data collection model for quality outcomes tracking. So all Medicare professionals were eligible to participate. If they were eligible to participate, they had to implement certain, data collection processes and make sure that their reimbursements to make sure that their reimbursements weren't being dogged. And this is something that's going to impact them like much later. So for instance, the model that's being the eligibility criteria that's being implemented in 2023, it's going to affect reimbursement in 2025. So this is, it's huge. It's almost, you have to plan ahead in order to make sure that those policy changes are not impacting you. So if your Medicare providers are doing, let's say, all these data outcomes tracking and whatnot, this is a good time to start implementing that more broadly. So you kind of are in line with those trends, because it's going to become important to start doing more data collection as an organization. It's already becoming important to maintain your accreditations. If you're like a CHC that has an FQHC, or federally qualified health center designation, you already have to do a bunch of this stuff, right? So I think that's really important to make sure that you're looking at what the federal government is requiring providers to do and then follow that lead. And then, of course, we're looking at, equitable care. Health equity is a big thing. Inclusive care, person-centered care. So I think, sometimes our providers can be a little bit reluctant to say, I don't want to do 2 hours of cultural competency training. And that's where we're like, You should, you probably should, just because it's not going to go away, right? It's only going to
Right.
become more of an intensive requirement. So you might as well just have a good starting point now rather than waiting until it's absolutely necessary for you to start and then you don't have good resources.
Yeah, no, some great examples there, Hira, and it's interesting how you'll see the change, and if you're aware, you have some time to do something about it, right?
Exactly.
Yeah,
Yeah,
and it's just being
absolutely.
aware. Yeah, go ahead. No, go ahead. You were going to comment on that.
Yeah, absolutely. So for training requirements specifically, normally what the state governments do and the federal government does is they'll say, we've passed this law, we've passed this regulation. You have to make sure that all providers are trained by, let's say, July 2024. So they're giving you that buffer period to make sure that you can create those trainings, implement those trainings, and make sure folks have time to complete those trainings. And I think with this, one of the things that, again, in trends that I'm seeing is that there's a lot of overlap. So again, from a policy perspective, if you look at all the different federal agencies, all the different levels of compliance, it's almost like people aren't talking to each other. So in the policy world, we talk about policy silos. And that's really what is happening in healthcare is that your federal government is saying one thing, then your accreditation agency is saying one thing, then your state government is saying one thing. But then if you take the time to just sit down and like look at everything that you're being required to do, you're going to start seeing overlap. And that's important to leverage if you don't want your staff to burn out. So if, on 3 levels, you need cultural competency training, make sure you have one training that meets all those needs. If you have to provide certain data on licensing, credentialing, tracking your staff composition, make sure that that's all stored in one place so you can pull different types of reports to make sure that you get all the data. But really, you don't want to be collecting that data 4 different times, 4 different compliance requirements. You want to be collecting one comprehensive data set. Make sure you have processes, structures, and systems in place to do that so you can pull what you need when you need it and send it over to the folks that are asking for it.
There is the blueprint for success in this area, and I love just having Hira here, kind of walking us through the blueprint. Really, that's what it is, so that you don't have to fall victim of not getting the appropriate reimbursement or getting penalties. I'm a big fan of success stories. Do you have any that you could share, case studies, for example, where the partnership you guys have had with different healthcare organizations has led to, success complying with these policies?
One of the things that we're really invested in doing right now is we've kind of mastered the area of federal compliance as just a training provider as in terms of just being able to make sure that folks have they're able to they have the resources to be compliant with what they need to be compliant with. So that includes telling them, well, you need this plan, you need this document, you need to be tracking this information, this data set at the federal level. So now we're finding that increasingly state agencies are tying regulatory training requirements, regulatory data collection requirements, also to like licensure renewal. So they would say, you need, let's say, 2 hours of implicit bias training, but also if you're a nurse in, let's say, Illinois, you need that training to renew your license. But everybody else needs it just because they need it because it's a regulatory requirement. So I think that's what we're doing in terms of helping folks in different states. So what we're doing is state specific gap analyses. And then what we do is we say like, okay, well, here's, if you're in behavioral health, let's say in California, here's everything that you need to become compliant. And that's really helped because a lot of the times folks might not know what exactly they're required to comply with, especially if they're setting up new facilities. One of the things that I think I run into that's almost always like a hit with folks is, asking them about their security risk assessments. So asking people, have you done a security risk assessment? They're like, yeah, I did one like 6 years ago. And it's like, okay, but you realize that your computers have changed since then, right? Are you using the same laptops that you were 6 years ago? No. Are you using the same people that you were using 6 years ago? No. So you need to redo your security risk assessment to make sure that gaps are accurately identified, risks are accurately identified. And then from that, we're able to create almost, this is something that almost always happens. Folks will say, okay, so I just did my security risk assessment. And then they will ask us to help them create a training plan that aligns with that security risk assessment. Something that helps that actually is resolved with that is the volume of training. So it might be that they were doing like 6 hours of HIPAA training and they were doing like all these sessions and they had all these documents and whatnot. And they're able to just kind of get rid of all of that with a security risk assessment that's current, risks that are identified, and then asking us to help them understand what they need to train people on, what risks they face so that they can kind of have plans to specifically address those. And then their training period might get shaved down to like, let's say 2 hours or so. And so that has almost always been like a good success story with HIPAA compliance. I think the other thing that we are really good at doing is collaborations. So one of the things that we realized people were struggling with was mandated reporter trainings. So mandated reporter trainings are applicable to basically all mandated reporters, and we're all mandated reporters essentially in healthcare, right?
Yeah.
So if you're a provider, you're a nurse, you're a receptionist, and if you're seeing an instance of neglect, abuse, any sort of anything that's causing harm to like a minor or a person in a vulnerable place, you're required to report it. And so we were finding that states are increasingly coming up with trainings that they house on their websites, and they say you have to do this training and this training only. And so we're able to work with states to get that training incorporated into our LMS. So that way people know and they have the reassurance that their state has sanctioned that training, that is the required training that they're supposed to take. And again, it reduces burden for them because they know they're taking the training that they need. They're not taking extra, hours. They're not in compliance because they're taking a training that maybe doesn't have all the content or the state specific processes. So I think those are two training specific examples. And then I think one of the things that we've been really successful in doing is working with ambulatory surgery centers and then with community health centers. For ambulatory surgery centers, we have helped, I think, dozens, if not more, if not hundreds of organizations stay compliant with their AAAHC accreditation. That's really important because that also affects whether or not they can receive CMS funding. So that's something that we're really able to help them with. We have a consolidated bundle. And, it's interesting because we create these bundles almost in collaboration with folks. So when new requirements come out, especially really extensive requirements, because we're not running an ASC, right? So we're not,
Right.
we're relying on them to come back to us and say, you know what, this is good, but this isn't really something that helps my staff understand exactly what needs to be done or what they need to do correctly. So that's something that we're able to help with AAAHC accreditation. And then the other regulatory update that recently came out that we kind of got a jump on and a lot of folks were really appreciative of is the FTCA updates. That's the Federal Tort Claims Act, and that applies to all federally qualified health centers. So we were able to understand what the requirement was. This is something that actually didn't have a lot of time buffer. I think the requirement was published in April, and by June, folks had to submit their application for designation.
That's a fast
And
turnaround.
yeah, absolutely. And so that's something we were able to get a jump on. We started getting these calls and messages and emails from our clients, and they were like, "Oh my God, have you seen the FTC update? Like, what are we supposed to do? I need to submit my application? Can you help us create this training?" And so that's something we were able to help with. And I know I have a lot of success story examples, but another key one is our platform allows for customers to upload their own content or work with us to upload their content into the system. So what that does is, especially if we take the FQHC example, the federal government doesn't say, or this is HRSA. HRSA doesn't say you need to train on, vulnerable population risk A with 1 hour of training for your staff. They will say, identify the risk that affects your organization and then train people on it. Here are some key examples that might be applicable to you. So that's where we come in and we're like, okay, so we can't obviously create a training on every single risk that's going to impact you because we don't know. So here's what you can do. Create a PowerPoint, tell us what that risk is, and we will work with our team to get that training available to you in our system that's specific to your organization. So other people maybe don't have that risk, don't share that risk, are not going to benefit from that training. So the curated content really has been a massive hit with our customers.
Folks, I would hit rewind on this and re-listen because I think one of those is probably applies to you.
Right.
And certainly just really good to hear the variety of areas that you guys really stay abreast of for all of our listeners to take advantage of. Look, I think of compliance like sort of accounting, right? Like, do you really want to do your taxes yourself? Especially if you're a business, I think the answer is no. You work with the experts and then you get an advantage. And I think of these large IDNs and all the mergers and acquisitions, like you called out the multi-state sort of variability that comes with it. It could get complicated very fast. And so I really appreciate all the call outs and examples that you shared with us. Okay, so we're here at the end here. I can't believe we've already been chatting for 30 minutes. When you think about the future, let's look at the landscape, the horizon. What do you see and what do you foresee in healthcare policy, and how can organizations proactively prepare for these changes?
One of the things and I think this is common knowledge in healthcare, but just to call it out because of the sheer importance that this carries is we're moving away from a fee for service model, and we're going to continue to move away from a fee for service model. As one of the largest, most successful economies in the world, and not having the healthcare outcomes for our populations to go along with it, and then having these massive disparities, I think it's really important to recognize that on every level, we're going to continue to implement policies that are going to help close that gap, that are going to move more towards preventive care and primary care and away from streamlining specialized care just as an entry point into the healthcare system for folks. So I think that's important to recognize. One of the things, and I've worked, with some policymakers in actually multiple states during my graduate studies and then also afterwards. One of the things that policymakers are worried about is that we just don't have enough primary care providers. And we are seeing that primary care providers don't want to work in areas that primary care is most needed, which is rural areas.
Mhm.
And areas with low population density. So that's important to keep in mind, especially if large is a large organization, you're branching out into multiple states and into multiple areas. Really, the need is for primary healthcare providers, and a lot of policymakers are trying to streamline these workforce pipelines. I think with, especially teaching hospitals and with other training providers, we're offering like certifications that help folks bridge that gap. That's going to continue to happen. More certifications, more certified professionals that are non-clinical staff to help streamline, the care gap is going to keep coming up. So, for instance, I believe Kentucky is implementing, like a bridge model where they're using these non-clinical staff, kind of like social workers, but a little bit more administrative, who are connecting people to healthcare, who are connecting people to like insurance that they're eligible for, to reduce that disparity, to make sure more people are with it, like have insurance coverage. And I think that's going to continue to happen moving like further along. You need non-clinical healthcare staff in your organization. So I know a lot of us are just sort of like, okay, well, we have, 5 providers in our practice. We don't really need a compliance officer. We don't need a care coordinator. We might not need somebody who can, or like a billing person, right? But really that's a trend that's gonna continue to kind of haunt folks because it's gonna become more important to have streamlined documentation. It's gonna become really important to have an electronic health record system. That's already happening. So I gave the example of MIPS, MACRA. That's a requirement for you to be a Medicare provider at this point. That's going to become more streamlined. I think United, Aetna, a bunch of other large healthcare providers are moving in the direction of you have to implement electronic health record systems that are going to allow you to generate data to be able to send to them. They're also going to do more utilization reviews. Those are going to keep getting bigger, broader. So if as a provider, you're providing care, they're going to want to know why you ordered specific tests, why you ordered specific medications. The regulation on opioids is going to keep getting a little bit more stringent, especially with like the addiction epidemic that we have going on in the country. So those are some things to really keep an eye on moving forward and planning for, really. You have to plan. So at least 6 months before you're going to implement something, make sure that you have a concrete plan. If you're planning a month before or a few weeks before you roll out policy that impacts your staff, that's going to implode. More often than not, that's going to implode. It's going to create too much paperwork, too much administrative burden. You're not going to be able to track it accurately. So those are important things to keep in mind and just start discussions with your staff about like now, so that moving forward, when these become mandatory and these become a requirement for you to keep your facility open, to keep getting reimbursed, that this isn't like a big pain point that you have to scramble to resolve.
There's some great trend information for you to consider. And look, this is the beginning of it. Hira, you mentioned webinars. How often do you guys do those?
I believe we have a couple happening every quarter at this point that are open to the public.
Fantastic. So, folks, what we'll do this, as I said, this is the beginning. We have a couple more podcasts in this series, but it doesn't have to stop there. In the show notes, we'll leave links to MedTrainer, their webinars, and if people want to reach out to you here, is that okay? Can they send you a LinkedIn note or whatever?
Absolutely. Yeah. So just Google search Hira Rashid MedTrainer and it will come up.
Amazing. So we'll leave that in the show notes as well. Do not stop at just listening, folks. If you want to get on the outcomes rocket, it takes action. And Hira, I want to thank you for taking action and being with us today. Really appreciate your time and your insights.
Thanks, all. Great to be here.